kit currently being used, the RT-CMC, right? Where is it from, and can we source for a better test kit? Are we looking at it? What's the development?
No, there are two test kits. One is the rapid test kit, and then the other one is the gold standard is PCR, RT-PCR. So all our 43 hospitals now, whether in the public sector or private sector, we are using the RT-PCR. And the capacity that we have a day, we can do maximum to 11,000 now. We hope that we can increase. Today, I think we can do every day is 11,500. So the capacity we can push to 16,500 from the 43 labs that we have, public sector, private sector, university, and Ministry of Health. So we hope that there are another 5 more labs in the process. But more importantly is that the turnaround time may take some time if you use the PCR. So we do have challenges there as well, but we are trying our best to see how best we can increase the capacity in terms of using the PCR at the moment.
That's the one that gives the
most accurate reading. It takes longer, that's right. And the confirmation is using PCR. We do have the test kit, antigen test kit. We've been testing 2 brands from China, 1 brand from Korea. So far not reliable, and the accuracy is below that. One is below 50% and the other was only 56%. So we will continue to test a rapid test kit. The good thing about this rapid test kit is that it's point of care of testing, which means we don't need to send the sample to IMR or etc. So with the clinic, for example, doing the swab, and if you have a biosafety cabinet, you can test it there. And the results, probably we will get the result much faster, maximum of 1 or 2 hours maybe. So that depending on the time taken for us to get the swab. So we hope that we will have a reliable test kit. We have been assured that, for example, next week we'll have another test kit coming from Korea. So we are looking forward. Hopefully, they promise us that this is more than 80% accuracy. So if 80% accuracy, we can use it. But if 50% accuracy, it's very difficult for us to use because there will be false positive and false negative. You think you don't have it, then you have the virus. You think you have the virus, you may not have the virus. So this is the issue of false negative and false positive.
Datuk, just on the issue of testing, yesterday immigration is saying that Malaysians who are in Singapore, who work in Singapore, they can be tested in Singapore. If they test negative, they can come back without quarantine. Is that advisable?
Our agreement with our counterpart in Singapore is that our workers in Singapore, upon completion of phase 1, and then if they want to come back, they have to be tested in Singapore. So if they are tested negative, then we do not need to repeat again. So we will accept the negative test, and then we'll do the necessary for them.